back to KAFTAN Television, and for those of you who are just joining us, this is Daybreak Africa, and our topic for discussion is the new global health threat posed by the HMPV, the human metapneumovirus. Yes, and in the recent years, the global landscape of infectious diseases has been increasingly marked by the emergence of new viral threats. Among these, human metapneumovirus has gained significant attention as a growing concern for public health. Despite its growing prevalence, the HMPV remains relatively under-recognized, with many individuals unaware of its capacity to lead to serious respiratory infections. As we delve into deeper the current global health crisis, understanding the threat posed by the HMPV is crucial for both prevention and management, especially as the virus spreads across different regions and adapts to changing environmental conditions. And with us here to discuss further on this topic is Dr. Olubusayo Modupe, a medical practitioner. It's good to have you here, sir.
Thank you very much.
Welcome once again to the show, sir, and Happy New Year to you.
Same to you.
Yeah. So now we are having global threat again, global health threat again with what is happening in China. And yes, people are still saying it's in China, it's not in Nigeria. But what's your take on this whole issue around this HMPV, actually the metapneumovirus, which people are talking about out there? Is it something we should fear so much, just like the COVID-19, or we should just be a bit relaxed?
You know, in fact, the whole world has not fully recovered from COVID-19.
Yes, sure.
And if you remember then, COVID-19 originated from China, Wuhan in China, when it came, before it became a global issue. But COVID-19 was officially a new virus. HMPV is not a new virus. HMPV has been with us since 2001.
Wow.
Yeah. So it's not new. So it's different from COVID-19 that they had to name. This one has a name already. Since 2001, and it's common around winter and spring, and so outside the country the temperature, understand, they are it's still snowing.
Yeah, we are already in winter.
Yeah. Yeah. So it has been, but now the challenge is that the number this time in China increased drastically. That's why we are talking about outbreak. And you know, around this time all over, you hear of flu. Yes. It's also flu-like. When they talk about flu, what do you mean? There's runny nose, fever, cough. That's flu. But the truth is, it's not a new virus. So we don't, yes, everybody should be concerned, but we don't need to, will I say, be too afraid. I understand, because there's a popular saying, once bitten, twice shy. COVID-19 came just like that. We thought it's a small thing until
it became so
big that we were locked in our houses. We cannot travel out of the country. Before you travel, before airplane takes you, you must do tests, you know. Yes. So that's why everybody is now very conscious. But the truth is, MPV is not a new virus. Since 2001.
Okay, so you are saying that we should not be at alert?
No, I'm not saying we should not be at alert. I'm not saying that. But, you know, we can, because of the fear of COVID-19, there is possibility that we overreact. Let me, yes, that's why I'm just emphasizing that it's not new.
Okay.
We don't need to panic. That's the right word.
Okay.
We don't need to panic. Yeah, we don't need to panic. It's not a new virus.
It's not a new virus.
Yeah.
Well, unlike the COVID-19, are there different signs attached to the HMPV, like HPM, like the COVID-19? You know, COVID-19, just like you talked about flu and all that. Now, one of the fears people are having, especially in China majorly, is the fact that it's unlike, it has its own uniqueness. So I don't know, from your expertise, what uniqueness is attached to the HPMV that is kind of feared to a point that even WHO is already beginning to recognize it as an emergency, because China recently already called for an emergency on this particular health issue, and you know, Nigeria to every other country is also working out their borders for
Yeah,
it.
because when it, you know, for example,
Okay.
a little digression, malaria in Nigeria, we won't call it an outbreak,
Yeah, definitely, we can't.
because virtually, regularly, some people will have it. So, why China is raising the alarm currently is that the number of people down with it at this time is higher than it has always been. It's still a flu-like disease.
Okay.
Yes, catarrh, runny nose, cough, fever, general body weakness. Is the same. The common code that we have frequently will also present
The same symptoms.
the same way. But now, HMPV is commoner in children. Less than 5. Of course, older people are also at risk above 65. They're also at risk. Then those whose immunity is low, HIV, those who have cancer,
That's already it.
or those who have autoimmune disorders, they are at risk because the immunity is low. Why are the children at risk? The immunity is not properly developed. As older people, of course, the immunity is getting weakened. There is also worse in those people who have chronic respiratory disorders like asthmatic, or those with what we call chronic obstructive airway diseases. It's also worse. And so naturally, because it's known, if you have been infected once, you have a little immunity against it. If you get infected again, it cannot be serious. Again, diverging again to our malaria. If a Briton comes to Nigeria and develop malaria, is likely going to develop a very severe malaria.
Yeah, definitely.
Because no previous exposure, no partial
It's just a
immunity.
new thing to the body.
Is immunity. But for a typical Nigerian, you are partially immune. And so that's why it's not every time you have a bite that you are down with malaria. And so if you have a previous infection with HMPV, you have a partial immunity. Even if you develop later, it will not be severe. So now the numbers are on the increase. That's why it's called an outbreak.
So can this be treated? At least for malaria, at least we have like.
Yeah, it's what I'm just trying to.
and stuff.
Now, the challenge about most of these viral diseases is most are self-limiting. They go on their own. And so most of the times what we do is we call it symptomatic treatment. We treat the symptom the patient is presenting with. They can have body pain, you give pain relief, you can give something to decongest the nose, but you are not really treating. Although some drugs are they are on trial for it now because it's now on the increase. But most viral infection, they are self-limiting. The common cold that we have, the running nose, is a viral infection too. In fact, it's in the causative organism is in the family of the HMPV. They are family members. And when you come to me and you tell me you have a running nose, because it's viral, typically the doctor will give you a pain relief. There's no particular drug they are giving you to treat it because it's viral. What can treat viral infection is antiviral. So as it stands, is symptomatic treatment. Occasionally, when there's a possibility of secondary bacterial infection, then antibiotics can be added. But antibiotics is not a drug for virus. Antibiotics is a drug for bacteria, whereas antivirals are used for viruses.
But now looking at it now, we talked about the fact, you've explained to us that symptomatic kind of treatments and all that, and those who have already underlying health issues are the ones at higher risk
of developing
like
even having a severe disease.
Yeah, that was the same situation with the coronavirus and all that. We talked fully about the fact that this year we are still recovering for...
No, COVID-19 is even less in children.
But more in youths.
No, because you are the active. The youth are active. They are everywhere. They are likely going to get infected.
Okay.
You are the one that goes to overcrowded places, the youth.
Children will never go there.
They will not likely be there. And so, of course, because of lifestyle, the youth working group were affected more with COVID-19. And it was easier because a lot of them also survived because their immunity was at least strong. And so if elderly now develop COVID-19 then, or those with poor immunity, like those with diabetes mellitus, it tends to be very severe, and causing loss of life.
So that means if I'm to go by this your logic, because now you're saying that HMPV affects more of people who are more of toddlers, children,
yes, it's
elders.
commoner that can affect everybody. I'm not saying it
affect
cannot
everybody,
but it's commoner.
It's commoner, that more common with them.
Yeah.
Now, and being more common with them, they don't really have the immune system.
Yes, the immune system is not
like a youth.
Yeah.
Now, don't you think this has a bigger capacity to cause more fatalities than even the COVID-19?
Well, the virulence, that how dangerous the virus is not as virulent as COVID-19. That's all the truth.
Okay.
COVID-19 is officially a killer virus. New, no study on it. nothing is known. Why now the challenge with HMPV as regards children is that, you know, a lot of them, they don't even talk. They are not at the age where they talk. They are not even complaining. Will a 6 month, 7 month, 8 month old tell you, I'm having a headache? They are not talking. So it's now the responsibility of the caregiver. No, the body of this child is hot. It's having running nose. There is cough. And you know, in China, all these places, they are likely going to go out. I mean, go and meet a professional almost immediately. Thank God it's not in our environment, for example, in Nigeria. Thank God it's not here now. You know, if it gets here, it might be very catastrophic. Why am I saying that? Because the truth of that, these children, they are not talking. In this environment, virtually every mother is a doctor. Every mother is a nurse.
Nigeria.
They will use what kind of drugs for them?
They will tell you, this is what I used for his brother. And it worked. When he had something like this, we go and buy. So that's why if it gets here, we pray it does not, it might be catastrophic. Because a lot of people do self-medication.
Yeah, in this part of the world actually. And I'm even looking at a way of more promotions to ensure that, unrelated, but do you think this issue of self-medication of a thing can never become a thing of the past in its most reduced form in Nigeria in the shortest of time, from your own perspective? Because I discovered that even during the period of COVID-19, self-medication became the order of the day. So do you think it can actually, because people will even look at, why I'm saying this is, I remember a friend, the first friend that I never knew about the news as at some weeks ago. So the first friend that just posted it was like, China has started again. And I asked him a question, what does China started again?
Because it started COVID-19.
Then the next thing he did, he sent me the link of the whole story and all that. And while we were talking, another friend just said, oh, we conquered COVID-19, that Agbo is there. So that's why I'm asking this already, that do you think it can be a thing of the past in?
Not, I don't think in the nearest future, but hopefully sometimes later. Even apart from local apps, all these things, virtually every citizen can enter a drugstore and purchase anything
without even prescription.
Whereas in most places there are some drugs categorized as over-the-counter drug. That's what you can just pick over the counter. Every other thing must be with prescription. I believe one day we'll get there.
One day.
This HMPV, is it like a particular environment in which it thrives in? Like probably like the cold environment?
Yes, because that's why it's commoner during winter. Yes.
Okay. But you know, we don't really experience winter
in this environment.
Country. So
yes, that's why, you know, there's so much possibility that it might not really thrive here. It might not. It might not. But again, if you understand how organisms, viruses, bacteria, all of them act, they're also very wise. There's what we call mutation. They mutate a lot. They change. So one of them, in quote, can change to an extent that they can live in our environment. Those are possibilities.
That means virus can be very adaptive.
Yes, yes.
Wow.
They mutate. And just to get, is to escape on Earth. Let me put it like that.
Because
And they also want to maintain their lineage. Just like human beings want. Yes.
We know we used to hype the fact that we say it as if men are just man is the smartest of animals and all that, and people used to underrate the intelligence of other microorganisms.
Even animals, they are everyone intelligent to in what they do. They need to adapt. When it's dry, why will a snail use something to cover itself? When it's dry, you notice when you pick this, there's something covering it.
Yes.
If that thing is not covering it, it will go into extinction because every fluid in it will get dried off and need it. So want to maintain until there is, when it's raining, you won't see that on any snail.
Well,
everybody is smart.
Everybody's smart. Everybody's smart. So we can't actually underestimate this by any means. Now, from your own perspective, do you think the Nigerian government is doing enough to guide against experiencing such?
Now, if you listen to news today, the NCDC already issued an advisory reminding us about what we're doing during COVID. Because it's also airborne, touch, if you touch contaminated surface, it's the same way of transmission. So they are reminded us again of the things we have forgotten.
So, by remembrance of the things we've forgotten, we have to go out there and guide everything that needs to be done. I just hope that we can actually meet up with that, because to a very large extent, I know children very well, especially children can be very taciturn because this affects them the most. I know that the COVID-19 period, I was with a child on the road and don't touch this, where the nose marks for them. At the end of the day, they pull it out themselves. But then we'll still look more into this. But first, let's just take Gold Start for today. When we are done with Gold Start, we'll go back and then discuss more on some technicalities that has to do with the HMPV. But please stay with us. This is Gold Start. Back. I hope you're enjoying Gold Start. And yes, if you're just joining us, this is Daybreak Africa. We are discussing about the HMPV actually, and Dr. Modupe here was just bringing us to terms with some of the moves of the Nigerian government, reminding us that we should go back exactly to what we have been doing in order to try as much as possible to curtail this virus ever coming into this country. But I want to ask a very tricky question here. In the worst case scenario, if it comes to a point where the virus spreads out of China, do you see?
It's already in Malaysia. It's already in India. Now, so it's already out of
China. Do you see it as a threat to such an extent that it can become a global pandemic?
Well, you said it's a tricky question. It's really tricky. Except we see what is happening currently. What we know is that currently it's just an outbreak, and so it has always been with people. It has always been there at this time, but it's higher. Now, some of the things where the science will be working seriously.
Definitely.
Are there newer strains? different from what they've been. Because when there are newer strains, due to mutation, there are times that they become more virulent than the previous strains. So I think these are the studies that will be on now. But for now, there's no special advisory all over the world concerning no travels, all these things. Because virtually all over the world, they always have MPV. It has always been with them, especially in the temperate region. And so we just need to be watchful and follow what is happening. You know, I was just thinking before I came. Do we have what we used to test it in Nigeria?
I was about getting
I was about
there.
to ask that
I was
question
actually
as well.
about getting there.
I'm not sure we have. So how do we even know
That's all
that that is not even in Nigeria already?
which is something that we need to even look at to a very large degree, because of the truth we don't. That's true. We don't have it.
You know, every of the running nose we think is common cold.
And we are at the time in Nigeria that we don't even have the strength medically as when it comes to human personalities as we used to have in 2020, because from 2021 till today there had been a massive exodus.
We must not have an epidemic in Nigeria currently,
Yeah,
because the health force
the
to
workforce
face it
health-wise is gone.
is damn too low.
But in case now, I'm not praying this kind of scenario actually happens. But in case it becomes maybe like an epidemic happens in the country right now, because we even need to look at, maybe that will be a topic for another day, the mass exodus of medical personnel in Nigeria. I'm still saying that maybe one of these days we'll sit, we'll analyze and address it, because in case a thing like this becomes an epidemic, I'm just beginning to view how can we handle it. From your perspective, you are in the medical field. What do you think really is like a quick time solution the country needs to be able to curtail the
there will be that means there will be what they call task shifting.
Okay.
Yes, a lot of people might not be trained, university trained. Yes, you just do quick training, and that's what they mean by task shifting. For this and do this. This is just a responsibility. When this patient comes and you notice it's coughing, check
the person.
The temperature. They did it during COVID. All the all the security in the banks, they are not trained to check temperature, but they were the one doing it. That's shifting. It's not the responsibility of a security man to be checking your temperature. Are you getting me? That's a typical example of task shifting. So they are trained. Just press it, put it. You notice it's 36.3. Once it's 38, don't allow that person. That's task shifting. So while you are telling all those stories, he's not interested. Well, he has just been trained. Once the temperature is more than this, don't allow him.
Okay, let me just quickly ask this. Why I actually asked that question was because of the fact that I checked over the weekend. I checked the doctor to citizens ratio. I was checking it. An online media actually brought it to our notice, and I was checking it, and I discovered that we are short of a lot
Seriously
of personalities
short
at this particular time. And with this start shifting, definitely there's no way I'm not going to go back to at least safety precautions on the outside. Though it might not be self-medication, but just quick safety precautions. What symptoms should we look out for, especially for parents who have children out there who, like you said, they can't speak? What are the common symptoms we just quickly have to just look out for that makes it unique enough for us to just, okay, let me just quickly take this child out of the hospital, let them really confirm. Do that to that extent.
Because it comes like common cold. So that means every runny nose with cough fever could be HMPV. Could be. So the onus is now on the hospital to check is it HMPV or not.
But it's one that we don't have the equipment to check it.
Well, I know government will be doing something.
Yeah, government will definitely have to.
They have to.
They have to actually
They
do something
have
to
to.
actually get it. But then, what advice do you have for people out there naturally from this particular time? Because I think for the Nigerian populace, we are faced with multiple. Many people don't even pray that this becomes an epidemic. Or
Some don't even know it exists.
we don't even know it exists.
Because it's new. The news is just it's just coming on.
It's just spreading. But
I think just before Christmas, it was in I think December that all this thing started. And again, remember, COVID-19 started around
exactly the same time. Some people are even sharing some what do we call it? We say conspiracy theories. That why is it that it's during the time when maybe Donald Trump wants to become the president? Some are saying that it's a global, it's like more like a chemical war, viral war, and all those kind of things. But then I just like to stick to matters the way matters are to a very large extent. But then if we are to look at it from this angle. Because Nigeria actually is a surviving nation. We survived the Ebola virus. We survived the COVID-19.
No, you know, did we survive Ebola virus? Somebody gave up our life. You know, may our soul rest in peace. And thank God that resident doctors were on strike then. If, for example, I think the name of the man was Sawyer or something.
Yeah, Sawyer.
If that man entered Nigeria and was taken to a place like Lut, we will not be able to survive it. Because the number of people that will get in contact from house officers to residents, senior residents, consultants. So the number of people that we see him will be massive. And of course, after everybody will have gone home. But went to a private facility, of course, the number of people
there is controlled.
So thank God it was during a strike. Remember? So I don't like hearing that we were able to curtail Ebola.
We were lucky.
We were lucky. We were just lucky. It's luck. What was the program we had to help us curtail it? There was nothing. Except somebody died.
And the blood of the person became the redemption for the whole country, actually.
There's nothing done to curtail it. How did the man get to the country? How did he get to the country?
At a time when we should all be locked.
No, there was not even lockdown.
There was no lockdown, yeah.
There was no lockdown, but it was coming from a place ravaged by Ebola.
And they could not check in quick from the airport.
And we allow him get into the country.
So do you support Nigeria, restricting anybody coming, maybe having direct, contact with China of recent, just being secluded for the meantime, quarantine?
No. But not everything must be on the lookout. Everybody, there must be they call it emergency response, preparedness. Now we know there's a problem in China and in some other countries. So what is our plan? We must be extremely ready in case it comes in. And from depending on the outcome of researches now, it's going to assist. Must we quarantine anybody coming in? We look into that. Then if you quarantine, who is picking the bill? That's another question.
Sure. For a quarantine, who is paying the bills actually is footing the bill for the quarantine. And we know that the federal government actually doesn't really have much as we speak in the country. Hopefully it doesn't get to this particular point actually. It's something. But one of the things that this thing just got to me is just that we really need a real overhaul in the health sector in Nigeria and that aspect, because you raised some very vital matters. We don't have the appliances to even check the disease. We don't have the virus actually. We don't have the manpower as we speak, unless we go through, I've forgotten the statement you use,
Task sharing
actually. And we are getting to a point that even if we quarantine, who is going to foot the bill and all those kind of things. And I know vividly well that at the current budget of the country, health actually did not get as much share as it's supposed to get, as against maybe education, against security, and maybe education, security. Agriculture wasn't even much more on the list and all those kind of things. But from your own perspective, if I'm able to look at from an health officer, from a medical practitioner, this is just unrelated but a bit related actually, do you think the country is doing well as regards revamping the health sector from your own perspective? Because we know that many are out of the country already. So,
and many are still going. I'm not sure we are doing well. We are not doing well. And it's so unfortunate that most times we are always we are reactive. We are not proactive. Now, for example, you notice you have not heard much from NCDC. Well, now they just heard this now. We are hearing statement from them. That's reacting. So we need to be proactive. We should be ready. What is the plan? If there's an airborne disease outbreak, what should we do? If there's this outbreak, what should we do? Everybody should be able to act, because even when there is no outbreak, everybody knows what to do. It's not like, we've always had, if you are driving a car and you have one of the tire got busted, that you must not press the brake. It has not occurred, but severally a lot of people have been told that. And so if you are now driving and you notice that, if you have been imbibing that, you know that no, the only thing you just continue controlling. Don't press the brake, don't match the brake, and so if we have well-packaged plans for health, for example, there is a epidemic of something air. It's not an outbreak, airborne disease now. What has been prepared should be laid out, that even for citizens, everybody we know. And now, because it's airborne, this is what to do. Cough etiquette, we should return to it. Cough etiquette. Now you still see people sneezing like that. But during COVID, virtually everybody stopped. But we have forgotten again. When you want to sneeze now, you sneeze like that. Whereas the teaching everywhere is that you sneeze. Where are those IEC materials? The TV station, radio station, nobody is talking about it again. If you cough, it's compulsory, you must use face mask. It's compulsory. Even if everybody is not using face mask. But if you cough, you should know that you must use face mask. So when you are leaving your house, you know you are coughing, you go out with your face mask. Because you don't want to infect others. If the cough is infective, it should be part of our life. We should know that. Nobody is talking about hygiene again. Most places, when you get there, before you see hygiene station, either there's water and soap or hand sanitizer. Everybody, then in your pocket you have, in your bag you have.
We all have that, yeah.
We've forgotten. That's what NCDC is just reminding us again. And now, very soon, if the outbreak continues and it's spreading, the price of sanitizer will go up again. As it's a usual practice here, actually. Once the demand gets high, even if the supply is high, the price will go up. It's just a Nigerian phenomenon. So we understand all these things. Naturally, the truth is, in December, January, there is a lot of respiratory tract infection. You know, anywhere you hear cough. So before that time, all information about respiratory tract infection, how to prevent yourself from spreading it or infecting others, should be up everywhere. That is what we call being proactive, not reactive. Now we are hearing HMPV. Now we should do this, we should do that. We should stop that and act before events occur.
Talking about preventive measures, would you advise the government to carry out some sort of operation like medical screening, for instance, for those people coming from the country that has been infected by this virus?
But I don't think it has gotten to that level yet.
Okay.
No, just being proactive.
As a preventive.
Yes. You know, if everybody knows that coughers, that's who cough, must have their nose, mouth covered, and hygiene, is going to help a lot. But if the rate of transmission is high, and for example, a country has been declared, they now have an epidemic of the disease, of course, people coming from that kind of country should be screened before being allowed to your own country, or you quarantine them for the time of incubation period of that disease. In this case, which is I think around 3 to 5 days.
So the symptoms reveal itself.
Yes, the symptoms. So if the person appears normal to the country, may be carrying the virus already. So that's the principle of incubation of quarantine. So you stay here. So if it's even today that you left your country that you got infected, you will stay here for 5 days. At least we know if you will show symptoms, you will show within 5 days. That's the principle of quarantine.
So as we speak now, we've talked a lot. We've talked about the fact that proactiveness is very important at this particular time, which we need to go back to.
In fact, all the time, not this particular time. We should,
all
yes,
the time.
yeah.
Now, and you said something which is very interesting to me, that whenever we get to the December, January period, there is always an exposure
of respiratory tract infection. You notice everybody is coughing, it's everywhere.
And December was so dirty, we had a lot of IJGBs actually in the country. I know that. So that's where my own fear started coming from, and all that, because I know the disease started from, the virus started from around that December period down to this January. Though the IJGBs are gone now, but then we are back to a time where I'm now beginning to feel that maybe it shouldn't be law for the country as well, that anytime it's December to January, as much as you want to party, you want to dirty yourself, you have to take precautions too as well. But looking at it from it, we've gone far, we've gone wide, we've gone everything. And I think I like the fact that you already told us that we shouldn't fear.
Yes, we don't need to panic.
That fear part.
Yes.
I think I wanted to even tell you to just maybe elaborate more on the place of no panicking, because I think
It's
our
also
viewers
very
out there needs to get that to their ears,
Yes.
because here,
Yeah.
salt and water to bath now is going to be...
we don't need to use salt and water. We don't need to... People drink a lot of alcohol, thinking it will kill any virus.
Actually hot.
Yes, and that's why maybe 40%, all these very extremely high alcohol content drinks. It has no other advantage really. The most important thing is, if we understand that simple hand hygiene, covering nose for those coughing, sneezing, and the simple things, that even if you are exposed, does not mean you have a severe disease. Then avoiding self-medication, very important. Not every cough or not every runny nose is common cold. The message is it could be MPV, which may be more severe than common cold.
Wow. It could be more severe than common cold.
I like the way you made use of the word understand. Understand, like in taking precautions.
Yes.
Understand, not just knowing. Because some people know these things, but they just don't do it. They don't understand this. And I think it's something that even our media house should actually like.
Yeah, I think we'll even do more to promote and
Yes,
just to tell people about it on the out there, which is very important. Like you said, you don't need to fear actually. You actually don't need to fear. We hope it doesn't come over to this country. It can't. It doesn't come over to this country actually.
I know we cannot even cope. We won't be able to cope with all these things happening already, so we can't add.
We can't add. I
Yes.
know that in 2020 I had like 8 or 9 of my. I have a lot of friends who are actually doctors. Many have gone out of the country, but I know that as of 2020, I still had like 8 of them which I communicate with almost all the time. And to the, I wanted to say to the glory of God actually, but to the sad part of the country, not one of them is in the country as we speak.
You know, that was why, you know, a lot of people came from outside the country this December.
Yeah.
The IS I've seen in recent time,
we
and it was
party a lot.
partying throughout. You know what it means? Do you know if you bring $1,000 or £1,000 to the country around that time, you know you are a millionaire. You are going to spend
Extremely.
That's why we cannot just afford to have HMBV outbreak in Nigeria.
It must not actually come. Thanks so much, sir, for being a part of this topic,
Thank you so much,
part of this
sir.
discussion as well, for bringing us to a point where we have to realize that we actually need to be proactive at this particular time. Though in being proactive, follow simple instructions. Let's go back to what we all did during the COVID-19 period. You know, cough right. Go back to your sanitizers and hand cleaning. You don't need to let the price go up before you buy one actually in your house. We can go back to, is the glove necessary actually?
The glove is not necessary. You are not touching blood. You are not a doctor.
Because that one is what I don't really like actually. Nose masking, at the point, nose masking was, you know,
It's very
it was fun because we had our kind of Nose mask.
Yeah, but the truth, even bike man now, they are using, because of the dust, they are using,
Yes.
and they are not complaining.
Yeah,
But then when they were giving, they would complain. But it was during that time that
adaptations came
they
in.
noticed it has some advantage. That's why you notice bike man now,
Yeah,
they are using face masks.
face masks and all those kind of things. So it's very important we go back to all this. Thanks so much, Sakran, for being a part of
Thank
this
you
discussion.
so
I hope
much.
you enjoyed it.
We learned a lot.
I actually learned a lot from this actually, and I'm very happy that this came today. But then it's time to go for sports. I know some of you are already excited for the sports segment, and once again I will tell you that KAFTAN TV gives you the best, especially on Daybreak Africa. So enjoy sports for today, and when we're back we'll say our goodbyes till meet tomorrow. Do stay with us.